Later this week, we expect to learn if North Carolina will move into phase 3 of the reopening. Today, state health officials reiterated that our COVID-19 trends are heading in the wrong direction. Today, we saw 622 new cases around the state, which is down, but has been typical of days on Monday coming out of the weekend. Now, the part health officials are concerned with is the yellow line there that represents the 7-day rolling average, and that continues to go up. Hospitalizations also a concern. That number is at 870 people in the hospital now. Health Secretary Dr. Mandy Cohen laid out several areas of concern today with that increasing number of young people and people under the age of 49 who are getting the COVID-19 virus. And there's also been a spike in the Latin community. There have been 3 reported clusters also that link back to child care facilities, something Dr. Cohen says will need to be reflected in the data they release.
So we know we have lots of child care centers across the state, so having 3 is not a huge number, but it reminds us again about the importance of the transmission of this virus. It's in our communities, and we are starting to see more spread in settings that involve our kids. I'll remind folks, for our children, what we see is that for the vast majority of kids, that kids are less impacted by COVID-19.
Governor Cooper said last week they've been talking about a statewide mask mandate. He said he expects a decision on that sometime this week, but he hasn't said what it might look like exactly. Today, I spoke with Senator Jeff Jackson, who represents Mecklenburg County, about his thoughts on phase 3 and masks.
When we started phase 2, we originally wanted, before we started phase 2, to see a decline. Well, we didn't get that, but we got a brief leveling. So that's when we kicked off phase 2. But now we've got an increase. So we don't have an exponential increase. That's worst case scenario. That's lock everything down. But we do have an increase. So we have to do something. It's not the situation where you can say, go back to normal, we've beat this thing, because we haven't. Well, cases are on the rise. So we have to take some step. Are we going to get some kind of phase 3? Yes, I think we are. But I think it's going to be tailored to a situation in which numbers are increasing. And I think masks are going to play a huge role. We need to be wearing masks when we go shopping. I don't want to do it. You don't want to do it. It's annoying. But if we're going to keep these shopping centers open, everybody has to wear a mask.
Tonight, the senator also said that the trend most concerning, or something he needs to watch the most right now, is again that number of people in the hospital. That number is up as high as it's been, and he says he wants more clarification from the state on how they track those cases.
We're seeing the hospitalization number go up, but what we need to know is, are those people who are in the hospital because their case of COVID was so serious that they had to go to the hospital, or are those people who are there for knee surgery? And as soon as you show up for knee surgery, the first thing they do is they give you a swab and they test you, and oh, it came back positive. So now, are you hospitalized with COVID, or are you hospitalized for COVID? We really need to disentangle those two numbers.
South Carolina also seeing a spike today. The state saw more than 1,000 new cases, and more than 12% of the people tested were positive. South Carolina leaders say they don't plan to shut down again or require masks, but they do urge people to do that voluntarily to curb infections. As the rest of the country also continues to reopen, the Carolinas aren't the only place that's seeing a spike. More than 20 states are now in an increase. A new model says Florida could be the country's next epicenter. There is a projection in Miami saying cases there could skyrocket in July. Most of the people getting sick, they say, younger folks. More than half of the cases reported Saturday were people under 35 years old.
That's an indication, certainly in that age group, that you're seeing more transmission in the community. It's not purely just a function of the fact that they're testing more.
As the U.S. continues to lead the world in coronavirus cases, now 2.3 million and more than 120,000 deaths. Worldwide, there have been more than 9 million cases.